Good afternoon. I'll be presenting on behalf of Medicine 4 on WEEVIL Killer. History. Mr. S, a 40 years old gentleman, presented with alleged history of consumption of an insecticide. The time of incident was around 10:30 a.m. on 20 March, and place of incident was at home and is due to a family discordance. Initially, they did not have the compound, and they brought the compound, which was a CARTAP hydrochloride, and he has taken a handful of a bluish green powdery substance. It was coming up to 100 gram. It was not mixed with alcohol or any other substance. So while he was consuming the powder, his brother actually saw him and tried to stop it. So we actually don't know how much has he consumed. He was immediately taken to a nearby GH where NG tube was inserted and he was given stomach wash. He complained of severe epigastric abdominal pain with retrosternal burning sensation. However, there was no history of any vomiting, excess salivation, lacrimation, bowel or bladder incontinence. And there was no history of any breathlessness, headache, altered sensorium or seizures. In view of the persisting abdominal pain, he was brought here. No other significant past histories or previous attempts. He is a chronic alcoholic who consumes around 180 ml per day for the past 3 years and he doesn't smoke. So when he presented to casualty, his pulse rate was 86 per minute, regular, BP was 160/90, respiratory rate was 18 and saturation was 98%. There was no pallor ictus, cyanosis, clubbing, lymphadenopathy or pededema. His systemic examination was normal. His GCS was 15/15. His pupils were 2.5 mm and equal and reactive to light with no focal neurological deficits. So his investigations, his hemoglobin was 13.8, counts were normal. His electrolyte showed sodium of 144, potassium of 4.2 and bicarb of 22. His renal functions and liver functions were also normal. He had a calcium of 8.09 and a phosphorus of 3.1 and corrected calcium came up to 8.8 and cholinesterase also was almost normal, which was 8497. So the final diagnosis was a deliberate self-harm with CARTAP poisoning. So what is this CARTAP? CARTAP is a pesticide which was first introduced in Japan in 1967 and commonly used to control weevil and caterpillars. Weevils are nothing but beetles which feeds on pests. It's an analog of neristoxin, which is a neurotoxic substance which is isolated from the marine annelid Lumbriconeris heteropoda. So in India, what is the importance? It's actually available in two formulations, and it's either a 4% granule form or a 50% water soluble powder. If it's a granule form, it's usually used for insecticides against for the pests among the paddy fields and the sugarcane pests. However, the 50% water soluble powder is used against diamond black moth in cabbage and cauliflower, which is more towards North India. The WHO has classified this CARTAP hydrochloride as a moderately hazardous technical product with toxicity of class 2. So how do they act? The mechanism of action is by two ways. First one is by direct inhibition of the postsynaptic nicotinic acetylcholine receptor ion channels and also by inhibition of the 3H ryanodine binding to the calcium release channel in the sarcoplasmic reticulum in a dose dependent manner, which leads to extracellular calcium influx and induction of internal calcium release. So it causes tonic diaphragmatic contraction which can progress to respiratory failure. The internal calcium release will also activate the reactive oxygen species which can cause oxidant damage also. So how do they normally present? There has been isolated case reports, which is the largest case series which was reported in India in Odisha, where 11 cases were looked into in a retrospective way, and almost all of them had vomiting, drowsiness, altered sensorium, breathlessness, and hypoxemia, and almost half of them had hypotension, rashes, or allergic manifestations and seizures. The most common complications were either a hypotension and shock, and or seizures, and very less than 10% of them had acute renal failure or an ARDS. So how do we treat if someone presents with this? So it has been recommended to use gastric lavage and supportive care. If the recommended antidotes are L-cysteine and L-cysteine, which is 100 to 200 mg of L-cysteine IV or 20 to 60 mg of British anti-leucite intramuscularly. The effect of the calcium binding of this antidate is the mechanism for antagonizing the respiratory depression occurring in CARTAP toxicity. The other drug which has been evaluated in this poisoning is the NAC, in which the basis of this is that the CARTAP can cause this oxidant damage. So whether using NAC will help in preventing it. So there has been isolated case reports. Even we have when CMC also, where we have presented 2 case reports where people have come with deliberate self-harm, initially with sludge symptoms almost resembling OP, and we have given atropine. But later, when the compound was identified, we have started them on NAC, and both the patients have recovered within 48 hours, and they've showed improvement and clinically better and was discharged. This was a previous case report where they've observed 11 cases of CARTAP poisoning, where almost every one of them have survived and almost everyone have used NAC. So after this trial, they've noticed that there has been a beneficial role in using NAC in CARTAP poisoning. So our patient was also started on NAC and improved symptomatically and is currently discharged. So the take-home message is that CARTAP poisoning is an uncommon poisoning. We have case reports in our presenting to CMC Vellore also. It can cause respiratory failure due to diaphragmatic contraction, and it should be looked for. And treatment with NAC is beneficial in this poisoning.
Thank you, Kartika, for that presentation. Divya, you want to add something?
No, Patrick. Basically, we presented this just to highlight it's a uncommon poisoning. The toxicome which is similar, which can be similar to OP, with the unusual, like they can have very quick respiratory deterioration, which our patient didn't have. But we should keep it in mind in such a presentation.
Kartika, usually what is the mortality rate in this poison?
So previously, before 2000, there has been 10 case reports which have been presented, out of which only 3 have died, and all 3 were in Japan, and they didn't use NAC or they did not have any case series. So all of them died due to a multi-organ dysfunction. So after 2000, when they've started using adequate gastric lavage and supportive care and NAC, there has not been a mortality, sir. I've not found any patient died after 2000, sir. Only in 80s and 90s there was with 3 death reports in Japan.
Okay. Okay. Any other questions? If there are no other questions, let's finish for today's clinical meeting. Thank you all for attending this, and especially the people who presented. Thank you all.
Would like to thank